It's the Labor Day celebration in the small town of Douglasville, Georgia, a traditional stronghold for the Republicans. The parade is run by a charitable organization that provides financing for children's hospitals. Why do sick people in the USA need to depend on charity? Why does President Trump want to repeal and replace his predecessor's healthcare reform that intended to improve this situation? And why doesn't he succeed?
We're interested to know what is happening with healthcare in your country.
It's all about money.
It's all about money.
It's a business. It's not socialized like it is everywhere else. It's a business. You get sick, it's a business. Drug companies, hospitals, insurance, and they made it mandatory that you have it, so you have to purchase it from an insurance company, and then if you use it, they can raise your rates and whatever. That's a good thing about what we do. We treat children for free. Our patients pay nothing.
I think that health care is one thing that there should be no profit made on it. That's just education, hospitalization, health care, all those kind of things should not be profit driven.
Many U.S. Citizens agree with the expel of Obamacare because they voted for this president.
I didn't vote for him.
I didn't either.
I didn't vote for him.
I did because
my
I was part of the
sister-in-law-
mass uninsured. I was disappointed in how the president organized and arranged the national health care system. I agreed that there needed to be some sense of nationalized Medicare, but I didn't get what I was hoping I was going to get.
We're preparing to repeal and replace the disaster known as Obamacare.
One of Trump's major promises was that he would repeal and replace Obamacare. Many of his voters consider Obama's healthcare reform, and especially the compulsory insurance, an illegitimate intervention by the state, and many criticize the government subsidies. In some ways, it's similar to car insurances. Insurers need to cover some basic benefits, but the rest is subject to the free market and can therefore vary a lot. Only very few people can afford complete coverage. Percentage excess is often high, and the premiums are expensive.
My premiums have gone from $500 to $1,800 in 2 years for two people. Too expensive. I said if the government would get out of it, it'd save a lot of them people a lot of money. Obamacare killed us.
Obamacare's official name is Affordable Care Act, but the price range of the premiums is immense, depending on the competition of the insurance companies and on how many insured people there are in a state.
Hello.
Andy Miller is an expert in the medical branch and tells us about the advantages and flaws of Obamacare.
Obamacare's goals were to get more people with health insurance. It has succeeded. 20 million more Americans have health insurance now, either through the exchanges or through Medicaid expansion, than there were previously before Obamacare. One of the goals of Obamacare was to cut healthcare costs or control healthcare costs. That essentially has not happened, and costs continue to rise, both for people with employer-based coverage and people with Obamacare coverage.
Why?
It's a good question. It's the way our system works. We do not have price controls. It goes up more in medicine because there are more modern developments. I mean, if you get a drug, there's a new drug for hepatitis C, all right, over the last few years. The cost of that drug, if you have no insurance and no coverage, for 3 months is $90,000. $90,000. It's a great drug. It cures hepatitis C, but it costs $90,000. That's our system. That's how it works.
Health insurance in the USA was considered a private matter for a long time. Only since Obamacare is there an obligation to be insured. People who refuse are fined. Insurance companies acquired millions of new clients, but they are legally obliged to provide basic coverage for medication, vaccinations, and pre-maternity medical care. And, unlike before, aren't allowed anymore to refuse coverage for patients with pre-existing conditions like diabetes or cancer.
Suits him. Good. Now it says that if you have a pre-existing condition, so it used to be that an insurance company could say, well, 10 years ago you had this health problem, we won't insure you. And now they cannot deny you insurance based on a problem you may have had in the past. And then also emphasizes more preventative care. So allowing for people to be able to get annual physicals, get immunizations, for adults getting mammograms, colonoscopies, looking more at preventative health, how to prevent disease from happening rather than waiting until you have to treat the illness.
Many people used to delay medical examinations because of the high costs, often until it was too late. This is the case with Warren Jones. Even though he suffered from diabetes, he rarely had himself examined because he couldn't afford it. Today, his kidneys don't work anymore, and he has to rely on dialysis. As a dialysis patient, the state now provides him with the best possible care. It's absurd. The USA save on preventive examinations, but then pay the costly treatment for seriously ill people. Obamacare is supposed to eliminate this contradiction by regular checkups, but Trump voters feel they are being patronized by this. Warren is afraid of the consequences if Trump's cutback plans will succeed.
Hi, Juliet.
Hello.
Good to see you. Welcome. Come on in.
Thank you.
You're welcome. Braxton, come on. Good boy. Say hi. Relax. I'm a little bit, I guess you can say, fortunate in the fact that dialysis was available to me. So I'm definitely grateful for that. And to be able to have home hemo is a good thing.
Warren is on early retirement due to his condition. He's on a waiting list for a kidney transplant. It could take up to 8 years until he is eligible, which is why he searches for a donor by himself. Warren is quite communicative. Health is a universal topic. This young woman, too, would not have coverage without Obama's health care reform. The Affordable Care Act now allows her to be covered by her parents' insurance until she's 26.
Yeah, I have insurance with my mom, though. My mom, I go through her. She gets everything through her job, so she gets all of the benefits and everything through her job at GNC. So I'm just on there with her.
After
at
that,
26, I think.
You're in trouble. Now you have to do for you.
Yep, exactly.
Another column of Obamacare is the enhancement of Medicaid and Medicare. These state-funded health insurance models for people with low income, children, pensioners, and people with disabilities have existed for about 50 years. Obamacare enhanced Medicaid and Medicare, but the final decision was left to the federal states. Georgia, a state that is dominated by the Republicans, obstructed the enhancement, just like 19 other states. Georgia's capital, Atlanta, is a boom town. Coca-Cola and news broadcaster CNN have their headquarters here. Martin Luther King is the city's most famous son. The civil rights activist considered the inequality in health care for black and white people one of the greatest injustices. But the notion at the state capitol, the seat of Georgia's government, is quite different. Republican Senator Tom Price rose to great power here. He strictly opposes Obamacare and was appointed Secretary of Health and Human Services by Donald Trump. But he was dropped by the president when the repeal and replacement of Obamacare failed in front of the Senate in October. Price was forced to resign.
His department is responsible for running Obamacare's exchanges in the coming year. And there's a lot of concern that they will try to undermine it rather than try to help it make it work better.
Senator Michael Williams is another outspoken critic of Obama's health care reform. He was one of the first Republicans in Georgia to support Trump's candidacy for president.
Of Donald Trump, and how was your first meeting?
Well, yeah, the original decision to come out and support President Trump was based a lot upon the fact that he was going to be his own person. He is more bombastic and just animated when he's on camera for everybody than in person. In person, he was very cordial, very nice. Talked to my wife a little bit, talked to me, anybody that came up to him and wanted to shake his hands, he was very polite too. Just a very down-to-earth, for a billionaire, down-to-earth guy. So I am very happy with President Trump right now, and I'm glad he's the president.
What would you do with health care if you would be the president? The same as Donald Trump?
As of right now, yes. To repeal Obamacare. We've got to get that piece of legislation off of our books and allow the free markets more ability to work and exercise.
So you believe that when the free market is as free as possible, the healthcare will be more affordable?
Absolutely, absolutely. I believe once we take government regulations out of the way and allow the free market to actually work free, that we will be able to increase access to healthcare. We'll be able to see a dramatic decrease in costs associated with healthcare, which will make it easier for people to get healthcare and health insurance.
It means this country has two different opinions, very polarized.
Correct. Correct. There's the belief that healthcare is a right and that every person should have that just given to them, where my belief, and I believe most people's belief, is that here in America, we believe more in the individual. To say that health care is a human right, I'm not prepared to say that right now. I believe we all have a right to live our lives how we choose, and then we also have to suffer the consequences of those life decisions.
That goes completely against the basis of this country. We hold these truths to be self-evident, that all people are created equal, endowed by their Creator with certain unalienable rights. Certain unalienable rights, among these the rights to life, liberty, and the pursuit of happiness. Now, we didn't have hospitals and really much doctors back when that was written, but life and happiness, that's got to include health care. It's got to include health. And for some reason, we have just neglected our responsibility to have this as part of our community, as part of our civilization. I mean, what is the point of civilization if it's not to take care of everyone else?
Karen Kinzel is a doctor. She worked as an internist in New York before she moved to this provincial area in Georgia, because she feels that her service is needed here. Many people here live below the poverty line, like this patient.
You're welcome here too, it's free.
Never before were there that many Americans covered by health insurance thanks to Obamacare. But still, every 10th American has no access to health care coverage. Treatment here at the day unit in Albany is free of charge, thanks to many volunteers who work without pay. 2 patients allowed us to film them. Eve lost her job due to a prolapsed disc. Patricia is a diabetic. She only makes $700 per month working as a waitress, which is why she can't afford her medication.
Hey, hon, how are you? Fine. Good. Okay, have a seat.
The USA is the only industrialized country where average life expectancy dropped during the past few years. Among the 10 most common causes of death here are cardiac disease, strokes, and diabetes.
Diabetes and blood pressure, you can kind of say like, oh, okay, take care of yourself, it's your fault, and you don't know when that person's going to die. But when you have illnesses that you pretty much know what's going to happen next, if they don't get, pretty basic care that we know how to do. We have spent millions, billions of dollars figuring out how to do this health care. but we don't give it to everybody. We just give it to people who happen to luck into the system, that either, their father has insurance or they're on Medicare now. I mean, it's not an equitable system at all, and it's wrong.
We're supposed to be one of the richest countries. Insurance should be already there for us. It shouldn't be a problem. And then the way they charge for medicine and doctor visit, just for me to go to the emergency room, you charge me $300 just to enter that emergency room. That it costs too much. And I guess that's one of my reasons why I don't jump up and run to the doctors. I try to do home remedies first before I just run to the doctor because it's too expensive.
Because that money is not coming in, the hospitals are really struggling. We've had 2 hospitals closed just in my area in the last 6 or 8 years, and there's 2 more now that have just been sold. And that's never a good sign. They were sold because they're not doing well, and we're not sure they're going to stay open. It's already between 40 and 60 miles to a real hospital from Clay County.
Doctors, hospitals, and insurance companies retreat from areas where they can't make a profit. This is the case in many areas in Georgia and the rest of the USA too. The remaining insurers use their monopoly and raise their premiums.
Well, I hope, like I said, that our great President Trump that we have in office now will basically say, hey, the healthcare system that we have now isn't working, and we basically need to dump the Affordable Health Care Act and
Go back to the way
to the way it was. And basically it was interstate healthcare. That's the way you keep prices down and make healthcare more available.
Do you have health care?
No, because it's way too expensive for me to get healthcare. Yeah. I work for my own. How can I afford to pay out the butt for healthcare?
How much should it be?
Probably for me, at least $20,000 a year.
If you paid a premium for your insurance of $1,500 a month, $3,000, and paying half of that for insurance, how can you afford to live in a home or buy groceries or get the extras? So you have to do away with something to survive.
Reason why I wear a kilt is to help engage in conversation because people do stare with seeing me in a kilt. And it also helps me to share with them my kidney campaign in which I do not ask for money, but let people know what all I go through going through kidney disease.
Warren is considered part of the middle class. Employees with a full-time job are well off. Half of all Americans are covered by their employer's health insurance plans. People who have to pay for health insurance themselves can procure a private health care plan via Obamacare via the internet. The price depends on their income. They can also apply for government subsidies. This allowed millions of people with mainly low income to have health insurance for the first time in their lives.
And when you say Obamacare, people who aren't into Obama, they immediately, but if it wasn't for that, like I have friends that, thank God, get health care now because of that.
Not everything is perfect. It could be tweaked, I'm sure, but it has given people the opportunity to have health care, so I don't see a reason why we should try to get rid of it.
I am for Obamacare. I would like to see it improved and some things fixed, but generally I think it's the right direction.
Melody is a makeup artist. Her former health insurance plan didn't cover much. She had to spend $15,000 on surgery. If Obamacare had been in place back then, it would have cost her only half.
It is not an insurance company. They are just going to help you pay for your premium to whatever insurance company you go with. if you don't work for a company where you have a regular salary that you know you're going to make, every year, you are guessing when you're someone like me who works for themselves. Sometimes I have a good year, sometimes I have a not so good year. But it doesn't fluctuate that big. So I guessed based on the year before what I had made.
Melody and her longtime co-worker Terrell Jackson don't agree on this topic. The photographer is against compulsory insurance. She thinks that her risk of getting ill is low and the cost for insurance is too high.
With Obamacare, it was a toss-up. If I made more money, my insurance was going to cost me more, and if I made less money, my insurance was going to cost me less. So I wouldn't know until the year was over how much I was going to pay for health insurance. So to me, that wasn't an option. I wanted to know exactly what I was going to be out of pocket. So I didn't finish the application. And I'm healthy. I take care of myself. I don't smoke. I don't drink very much. I don't do drugs. In fact, I hardly do pharmaceuticals, only if I have to. I will go to the health food store. I take vitamins. I exercise daily. And I would have the insurance anyway, strictly for catastrophic reasons.
Millions of Americans who feel healthy prefer a life without insurance, but this is a slippery slope. The Daniels sisters are visited by their friend Greg. He is in a lot of debt due to a hospital bill, as he missed out on getting health insurance in time.
Hi. I was too poor for Obamacare when it first came out.
You were?
Yeah.
Why?
Because I hadn't started drawing my main pension. I only made $8,000 a year, and if you made less than $12,000 a year, you didn't qualify for it.
Oh.
I was too poor to qualify for poor man's insurance.
So you just have no insurance?
I have no insurance.
So he has no insurance, zero insurance. So if he goes to the hospital, he gets a bill that he can afford, so he doesn't pay it. And so they send him bill after bill after bill, and he just doesn't pay it. So what's gonna happen? It'll ruin his credit. He'll have no credit, and they may try to take everything he owns to get that money back. Like your house and your car.
Wait, I think that's them. They want me to pay that bill. They call every day.
All right. Y'all enjoy Georgia from Florida.
Obamacare was not perfect by a long shot. It was not. But it helped. I mean, I have Obamacare, but it doesn't cover the small things. It doesn't cover the first $5,000 in many people's situation, but it does cover the big bills, so it would prevent people from going into bankruptcy if, for example, they had to go in the hospital. You know, bankruptcy is, the number one cause of bankruptcy is healthcare bills in this country.
Since 2007, healthcare costs for an average family have risen by 25%. Insurance companies, hospitals, and the big pharma still control the prices and feel more obliged towards their shareholders than their patients. But there are other reasons, too.
One reason that costs are going up is that health insurance plans are having to cover more benefits. So the plans are more robust. They give people coverage that's actually meaningful. Another is that people who are buying Obamacare plans, so Affordable Care Act insurance, are not as healthy as the insurance companies thought they would be. And so when you have a sicker population, you have to increase costs to make up for the increased healthcare costs. So if we could attract more young, healthy people into the market, then that would put downward pressure on costs, but we haven't found a good way to do that yet.
I think it's mostly ideology. I don't think that there's anybody that in America that really wants to see a lot of uninsured people. But to cover everybody in our country, either as a single payer system or a national healthcare system like the European countries have, it would be a tax increase for folks like myself. There are people they're totally against any kind of tax increase for anything. And that's where we are right now as a political system.
So many people found that it wasn't affordable, and they saw that Trump is a multi, quote unquote, millionaire, He's a businessman, and maybe he would make it affordable for them, which I don't see how much he could make it affordable when they're not taxing the rich on these things. It seems like they're really getting after the middle and low class people.
Tonight, I am also calling on this Congress to repeal and replace Obamacare.
The Republicans in Congress rejoice, but Trump fails due to opposition among his own ranks, led by Senator John McCain. Obamacare may be disputed and flawed, but McCain knows that the repeal and replacement of this health care reform would be bad for millions of Americans. The president refuses to accept his defeat. He plans to disrupt his predecessor's health care policies step by his own decrees.
It's a really, really serious issue. I think that the industrialization of healthcare can't go far enough.
Everyone's like,
Warren Jones still hopes to find a kidney donor, and activists in Atlanta hope for an impeachment of Donald Trump. A woman imitates the president, and Warren plays along.
What happens to someone who may have, like myself, end-stage kidney disease, and with having that, it's not that affordable. So where do you place someone of my state? Yeah.
Well,
in order
you're talking
to get...
about the state of healthcare. New York is a good one, I know. I don't know, in California.
So why can't we make the state of Georgia just as good as the state of New York and California?
The state of Georgia is a great state, a wonderful state. It's a tremendous state, absolutely magnificent.
You'll never know when your body may end up with diabetes or you may end up with cancer. And at least having insurance, you're able to go to doctors without really having a care in the world, but the financial burden is what the problem is. The key word was affordable. It doesn't seem like it's affordable for a lot of people. So I think that that's where part of the problem lies, that it's not affordable. But everyone being able to have insurance, I think, is a wonderful thing.
And I think to myself, what a wonderful world. Yes, I think
It's a blessing for millions of Americans that Trump and the Republicans failed and couldn't repeal and replace Obamacare.